Howdy, folks, and welcome to week 2 of the Policy Corner. Nate and I were just saying that we both felt like it has been a really long, short week, and in honor of that, we're going to try to keep this short and sweet for y'all.
We're like Andrew said, we're going to keep it short and sweet. So first things first, we're going to launch into some bills. We've got a few more that have come out. First things first, we're going to touch on HB 215, funding for teacher salaries and optional educational opportunities. This is the school choice bill. It's obviously been a big topic this session, and we've been asked by a number of folks for our position. We haven't taken a position on it for a couple of reasons, mostly that a couple of school choice scholarship opportunities already exist for students with disabilities. That said, we are reaching out to the sponsor with some thoughts, which is mostly to ensure that the parents are fully informed about the rights and protections they may have to give up if they do choose a private school, like IDEA and 504, 88 protections, things like that.
Okay, and the next bill we've got for you is HB 235, Representative Stenquist Accessible Parking Amendments. You may remember this discussion from last year. This year's version merely requires a sticker be placed on the placard that is used by the person with disability only, or by the person who transports the individual, and warns any other person that misuse of a placard outside of those requirements is a misdemeanor under state law.
All right, next up, we've mentioned a little bit about this issue before. It's SB 106 for the caregiver compensation amendments from Senator Harper. This bill simply just directs the Department of Health and Human Services to apply for permission to make caregiver compensation for parents or guardians of Medicaid, home and community-based services waiver in participants, make those permanent. The pandemic demonstrated the health, safety, and economic benefits to supporting family members caring for their loved ones with disabilities. So it really, it builds on some of the successes of a similar program for spouses, which has been in place for a few years. So the bill is just one piece of it, but we'll also be watching for the funding for this in social services.
And the next one, I'm pretty sure we mentioned this to you all last week, but we actually have a bill this week, and that is HB 242, Representative Ward's Services for People with Disabilities Amendments. And this bill will be to fund to put waiting list funding in the base budget, which means that it will have hopefully the waiting list will have at least some funding each year, and what is different from what we told you last week is that it's not simply 200 people. Rather, it's for those with the greatest need of getting into HCBS, and as we figure out more about what the funding mechanism is going to look like and how that's all going to work, we will let you know.
All right, next up, we've actually got a few bills we'll cover in the mental health arena. We've talked about a few of these before, or mentioned some pieces of these in last week. The first up is HB 248, which is mental health services for adults, from Representative Judkins, who we've actually been working with on this bill for the past few months. And we're actually pretty excited to see it finally get a public release. The bill would create a statewide assertive community treatment, or ACT team plan, and it looks to add some ACT teams in areas where they are needed or don't exist. It actually also has some pretty good data tracking and reporting on ACT, and those who may benefit from it. So this bill is really just a good step toward expanding mental health community-based services for those with intensive needs, and we're excited to see where it goes.
Next up in a similar vein is HB 29, mental health support and law enforcement co-response. We worked with Representative Stoddard on this on this bill as he had been looking for a grant program for counties to create a co-response model for law enforcement. The bill now creates a grant program, but directs the response to be a mobile crisis outreach team or a best practice crisis intervention team, if MCOT determines law enforcement is the appropriate response. We hope this bill will decrease the likelihood of criminalizing mental illness.
Last up for bills this week, though, don't worry, you'll get more. I'm get more in the coming weeks. Don't you worry. But last up, kind of in a related situation to Representative Stoddard's bill. This is HB 66, Behavioral Health Crisis Response Commission amendments from Representative Elison. This bill stems from recommendations from the Behavioral Health Crisis Response Commission, as you may have guessed. This bill seeks some funding for more mobile crisis outreach teams and receiving centers, focusing a little bit on rural areas. Certainly, we support the spectrum of needs for those with serious mental illness, so we're happy to see the state invest in one side of that, which is responding to those in crisis. However, we'd really like to see more focus on the things like Representative Dudkin's bill that builds up the other side of the spectrum, a robust community-based system of supports that gives folks a place to go after a crisis and hopefully prevents them. So, it's a spectrum.
We know we'd hear from you about not being a complete policy corner if we didn't at least talk about the budget a little bit. So for all of you clamoring out there for it, this is for you. First up is social services appropriations. Next week is a big week. This will be your opportunity to comment on a lot of the funding items they'll be voting on in the following weeks. Monday will be Department of Health and Human Services and Medicaid. Wednesday will be state hospital and non-Medicaid behavioral health. Thursday will be more DSPD and Medicaid, and then Friday will be DSPD and long-term services and supports. And I think we're still trying to decide exactly what we're going to say and when we're going to say it. But I think our general plan right now is to focus on community mental health on Wednesday, and obviously DSPD on Friday. If you'd like to comment on any of these or other issues that are of interest to you, you can sign up for public comment on the committee's webpage, and they still have a virtual option. So if you can't or don't want to make it to the Capitol at 8 o'clock in the morning, you can still participate in the process.
All right, so that's what went down and what's coming up after a long, short week, and in the week one of the legislative session in 2023. For more information on other budget items not in social services or other things, please visit our website, disabilitylawcenter.org/public-policy. You can see our bill tracker there as well, which will be constantly updating, but should be up to date currently with most of these bills and budget items on the budget tracker. So feel free to check those out if you want more information. Otherwise, we'll be back next week with hopefully more excitement. We'll try to keep them short and sweet like this one, or hopefully short and sweet. And always thank you so much for watching the DLC's Policy Corner. He is Andrew. He's Andrew over there. And I am Nate, and we are the DLC's policy team.
Adios.